the session. Now, I would like to invite Dr. B K Rana sir for the next session on standards in stroke management. Dr. B K Rana sir is the CEO of Quality and Accreditation Institute. Prior to the current assignment, he was director and CEO in charge of NEBH. He served as board member of ISPA External Evaluation Association, and president of the Asian Society for Quality in Healthcare. He is also served as chairman of the ISPA Accreditation Council. Over to you, sir.
Thank you. Thank you, Abhinash, for your kind introduction. Thanks, Subin, and thank you, everyone. Desi Madam, Namaskar. Thank you, everyone, for
thank you.
bringing this show together. Like-minded people, like-minded organization bring together for the improvement of patient care specific to stroke care. So that's very timely, and I think we have been discussing that people know about heart attack, but very few people know about the stroke. The heart attack of the brain, actually. So it is important that a lot of awareness need to be created amongst public as well as amongst the hospitals, because I'm sure everyone has experience. I have experienced several times going to hospitals, seeing that a lot of time is gone in the emergency department and they are not able to identify as a stroke. And so golden hour, what our doctors, neurologists say, is actually not in their hand now. It is already gone beyond their thing. And then the blame comes to the doctors or the hospitals per se, that patient was not brought to the finest treatment. The treatments were available. So I think the standardization is actually one of the most important and critical thing in as far as the patient care is concerned for different organs of human body. So thank you once again. Thank you for inviting me and QAI for making a presentation. So I will be very quick and crisp in highlighting some of the aspects of accreditation standards, which actually just you had debated, and Dr. Arvind had just mentioned, and Dr. Kumar Velu, he had undergone the process, and he knows that it's not easy, and that's why he said at par with international standards, and you were or maybe tougher than that. So it's about how we seek, and I was able to join today, though I'm just finished my assessment of a hospital here and took half an hour earlier schedule so that I can make presentation. So I'm just going to briefly talk about accreditation standards for stroke management. Briefly, few slides on Quality and Accreditation Institute, because this is what we actually get into association with Indian Stroke Association. And that's when you mentioned actually, and we strongly believe the collaboration is the key to success for any program. When stakeholders, when the key people organization come together and have interest to improve, that's nothing like it. And as we know in healthcare accreditation since 2005-6 of existence in India, it's almost everyone in the hospital is about quality. And who drives it? The quality manager or the quality director or quality, whatever term you use, they chase everyone in the hospital to improve. But now this is the first time I would say it is clinician driven quality. The neurologists, the stroke experts come together and wants to improve, right? So that's what the change we could bring in association with ISA, that it's now time for driving the quality, excellence, improvement, safety by the clinician themselves, because they are the most important component of care delivery system. So QI started off in 2017, fastest emerging accreditation body. In less than 5 years, we developed 14 standards, different verticals, providing different programs, including Center for International Accreditation, who offers several programs for medical laboratories, testing calibration laboratories, and biobanking, which is related to health after COVID-19. A lot of research material is being sought from the researchers from the biobank. And if biobanking is accredited to international standards, they can start their research from there. They need not to put 2-3 years time to characterize any biological material. For healthcare, we offer end-to-end solution, starting from a clinic to ambulatory care to hospital or home care or transition care, out of hospital, inpatient rehabilitation, de-addiction center, assisted living, a whole lot of plethora in transition care standard, telehealth, then hotels, homestays, dialysis center, IVF, emergency department, green healthcare facility, patient safety on WHO standard, and last but not the least, primary and advanced stroke center. So we cover hospital care and post-hospital care. Hospital care through different programs, and post-hospital through home care, telehealth, and transition care. So we, in the chain of pre-hospital, hospital, and post-hospital. We cover hospital and post-hospital. Now we are working on pre-hospital care. Now, at the moment, technical committee is already working for last 2 months on developing accreditation standards for emergency medical services, different type of ambulance services, whether air, water, surface, any sort of thing. So they are already working on it. The aim is to complete the loop of healthcare delivery system, for starting from pre-hospital to hospital and to post-hospital. We are ISCO accredited organization as a healthcare accreditation body recognized by CGHS for empanelment purpose. Member of ISQA and board member of International Society for Telemedicine and E-Health. Published a journal for healthcare quality and patient safety. We deliberately started this publication to allow and to give opportunity to researchers to publish their work in quality and patient safety. Free online access, no charges for anyone. They can just go on and submit the articles. Now, before I put all the standards, why we change the standards? What are the benefits of changing standards or implementing standards in a healthcare organization, particularly now stroke management? It gives a framework to stroke care processes and reducing the variation. It does not allow in a system that if there are two experts following two different protocols, no, they need to follow the same protocol. And that's bring the standardization within an healthcare facility. And then when many hospitals use the same protocols and standardize their processes, so we can say this is standardized care, the stroke care across the hospitals which are providing stroke care. So that's the beauty. And then you can really chase each other and benchmark with each other to show that they are excellent in providing stroke care. People claim, yes, people say my door to detail time is this, my door to CT time is this, my door to lab time is this. But who knows about that time? Who really checks that time? When we have for last couple of months, we have accredited 10 hospitals for stroke care, advanced stroke care. And experience has been that they come to tell us, oh, we have been doing many things, but we have not been doing many things too. Now, this standard has actually put us to start looking on those points, which are very critical as far as the golden time is concerned or golden hour are concerned, or the best outcome for the patient care is concerned. It enhances patient safety. It reduces risks. And this risk is not only just clinical risk, but there are financial risk as well. It's an organizational risk as well. And when there is a risk, of course, there is cost of errors, and which is very high, which very organization cannot even defend. It helps implement protocols for stroke and measure performance based on indicators. And that's what the beauty of the clinical excellence programs is like. This is stroke care. Many hospitals are accredited, many hospitals are certified. What actually they are bringing in a specific care delivery model on a specific disease. This is how this stroke care program actually help center of excellence of stroke care in really looking at their own system and demonstrate their competence in delivering high quality stroke care. It also strengthens community confidence in the quality and safety of care and treatment and services of that particular hospital. It becomes benchmark. It becomes a sort of a landmark for people, the community, that, okay, this is the hospital we actually now know have been able to demonstrate through external evaluation their strength, their competence. It also supports high quality research and funding opportunities. So research is very important, and particularly in high quality areas like stroke or cardiac arrest or AMI. This is very important because how you improve on the protocols. Today we use one protocol, gives us something, how we can improve on the protocols or methodologies or terminology or systems which can give better outcomes. So it really empowers people and organizations to engage into research, and which can actually bring also the funding opportunities. If your protocol is submitted to a funding agency is based on sound principles of fundamental research or applied research, they are really good getting funding about it. So there are a lot of things can be really done. We see, I always give an example, then we cite examples of the West, and I give very few research comes out of the Indian institutions, Indian hospitals in healthcare. We hardly see it, right? Why they come from many countries outside, though we have a lot of patients compared to any other country. We have a lot of data, a lot of information, a lot of patients. We can be doing better than anybody else, and we can bring better research if we really get engaged to it. Of course, we have to devote time to get into it. Of course, increase visibility for the hospital. Then they claim that we are the stroke accredited organization, is accredited by organization. They really meant for that. Now comes the how the standards are developed. People say, okay, they are national standard, international standards, and how. So there are terminology, national standard based on national guidelines, international standards for international guidelines, practices, best practices, and outside. More importantly, how the standards are used, whether they are used within a defined boundaries of a nation or they are used internationally or globally. That's also defined how you develop standards. So we follow obviously a very standard protocol for defining and developing standards, which start with reviewing standards which are existing globally, scientific literature to that type of topic or subject which we are targeting to develop standards for. And then, of course, it is done by experts. It is done by experts of the domain. They are put together. They start writing that, and they come out with the draft standards, and it's open up for the stakeholder consultation. Anybody can give then the feedback on the standards to modify, improve, and suggestions to make it better. And then pilot testing is done, and we follow Rumba technique, which means the standards are reasonable, understandable, measurable, beneficial, and achievable. So these five pillars of any standard development. Of course, we also use ISCO external evaluation association ISCO principle for standard development, so that we make sure that things are done as they should be doing, and obviously get it approved by the board before we launch the program. Now, as I just mentioned, these accreditation standards for stroke care are driven by clinicians for clinical excellence in stroke care. Now, what is the framework of the standard which we have at the moment? We have 10 chapters of providing the outline, the framework for these standards. And out of these 64 standards divided into 280 criteria, which can be measured, and then compliance can be seen. So this is what it is. So it's not much different than what in a hospital accreditation or any other accreditation program would bring, but what it bring is the specialty. What it bring in the defined indicators for stroke care, what it bring it specific requirement for qualification and skills in human resources, what it bring it to having a certain minimum requirements in place to qualify even to apply for accreditation. For example, we have these standards developed for primary stroke center and advanced stroke center. So we have defined minimum qualifying criteria to qualify to apply for a primary stroke center. So these many basic minimum things, you should have access to neurology, having the CT machine, having this, that, having done minimum six thrombolysis in a year, this much patients you must have been seen. Because if you have not able to demonstrate that you have done thrombolysis, thrombolysis of patient, then how you would be able to demonstrate your competence to the assessor? So we define certain, similarly for advanced stroke center, we define minimum qualifying criteria to become eligible to apply for accreditation. And that's how the standards are different. Those components which are defined as a minimum, they are all put into the standard. So we start with the governance leadership, human resources, facility management, and so on and so forth. Not possible to cover everything, but I just take one slide for each standard to give you an overview of how these things difference and how they make difference in the life of hospitals and patients coming for stroke care. Now, for leadership, basically, it talks about the governance structure. And this governance structure is not just limited to the hospital governance structure, okay? Because most of the stroke centers are within the hospital. Okay? So this is not about only the top management, the CEO, and so on. It's about involving the leaders from the stroke team also. So this governance structure is talking about the hospital-wide governance structure, but it's tailor-made now for stroke unit or you stroke section, whatever name you gave to that unit, that now we are worrying about this governance structure of the stroke care team, stroke care center, which has the experts in the middle of it. And then it's revolve around how the responsibilities are assigned, how is legal entity is defined. So if the center is part of a bigger hospital, so the legal entity or status of a hospital can be considered as a legal status for the stroke center. And in addition to that, we also prescribe that whatever applicable laws and regulations apply to a stroke center, they should be fulfilled. For example, when you use radiation emitting device, you have CT machine, you have X-rays, particularly in this case of CT. So obviously you have to get an atomic energy regulatory board in India or any other part of the world, similar authorities which provide approvals for those radiation emitting devices. And so irrespective of the complexity of the organizations, The leaders of the stroke center ensure and promote quality and safety in the patients. They really understand what needs of patient compared to the entire hospital, which is actually fragmented into different departments. Now, your stroke team understand what their patient require, what is the specific facility they need to, what are the skills in their staff they need to have. So it's already defined, and it is become the responsibility of the leaders of the stroke team to provide the adequate resources, which in terms of human resources, financial resources, and so on and so forth. And second component, obviously, is about human resource. Human resources are one of the most critical element of any organization, because they drive the excellence, they drive the organization. And so the human resources which actually defined for stroke team is about like who is the medical director. We ask is a specific, we call it specific program medical director for stroke. So designated one, somebody with minimum qualification and competence need to be designated as a stroke program director. Similarly, stroke program nurse. So it's a defined leaders within the team with defined qualification and skills, so that they can ensure that the stroke center is delivering high quality and safe care to their patients. So and also it talks about how the staff in general is taken care of in the organization, about their needs, about their social economic needs, about their risk assessment in from the organization perspective, from inspection perspective, from physical safety perspective, and so on and so forth. Risk management about the facility, obviously, many of the things are taken care of the hospital-wide management team for, in fact, for facility management. But we, in addition to those licenses that require, we also look at what is specific to the stroke team, stroke center, how they are really providing the physical environment, which is free from any harm and free from risk actually to the patient and visitors, they come to their hospital. So in terms of the premises, in terms of the equipment, need to be ensured through maintenance program, through calibration program. They ensure that they are in good quantity, which are required, and they follow the standard protocols for their maintenance. And then not just maintenance, but preventive maintenance in order to make sure that they don't go down when there's a need. And obviously, infection prevention actually is linked to CHIC chapter, but the facility management plays an important role for that. Information management system is very critical, and it's little different than what we talk about in general hospital is about, because the communication, flowing communication from even from an ambulance ferrying the patient from home or a place to hospital, and even before. So it's pre-hospital care, how the information flows to hospital and how the hospital is now ready to take as the patient arrive to provide the necessary. It's about how the information is collected, how it is stored, how it is disseminated, how it is disposed, and how it is analyzed to make improvement in the entire system, including clinical outcomes. So it's about all those parameters which need to be captured. This is the most important chapter called improvement for stroke care management. Why? Because it is driven by indicators. It's driven by not only some general indicator which hospital can prescribe, but we in the standard have prescribed many indicators which are mandatory. They have to follow, they have to measure those indicators, they have to collect data on those indicators. So it's about patient safety programs, it's about quality improvement program, it's about benchmarking within the system, benchmarking with other hospital if they get a chance to. And that's the whole idea behind bringing this accreditation for more hospitals and accreditation of stroke centers to drive it. I'm sure that Arvind I'm not sure he has covered yet already, or it will be covering. So I will go.
No, this is covered. This is covered.
This is covered. So I won't go into details. But I'm just saying that this is what is prescribed. So they are prescribed in there. So you have to do it, right? We don't have any option that. It's not a flexibility to choose. You have to do it. In addition, you want to do more, you can do it. Similarly, patient assessment and care is about patient assessment from the perspective of stroke care. How the patient is assessed to recognize that there is a stroke, and then how you really measure it through different scales to recognize the level of care to be provided, what is to be done next, and then reassessment from time to time as per the clinical protocol. So it's like stroke code activated. Once the stroke code is activated, then the stroke team takes over immediately from the emergency department, and then first steps taken and then followed up through going into ICU or going to the wards or and post assessment things. Obviously, it's not different patient rights and education, but it's important when patient rights is about asking complications out of a procedure. It's also about the cost. At times when we go and see, the patient does not give any consent because they are waiting for the financial clearances. So, and hospital don't proceed until they get a consent on for the procedure. They can't proceed for that. And patient is not giving consent because they are still discussing about what to do, who will be paying, whether they can afford. So all those issues actually are very critical in the better outcomes for the patient. So how hospital actually deal with these situations, how they respect their rights for the care which is given to the patients. Medication, yes, very important, particularly the medicine which is required for the stroke treatment, like a thrombolytic agent, which is to be given, how it is to be given, and how much it is to be given is very important. And I learned from the exercise and from this standard is that the weight of the patient is definitely is important for every medication, because its weight on is calculated on based on basis the weight, but in this also very important. I learned that where as soon as you arrive in emergency, there should be at least one bed with capacity of weighing the patient, so that the patient weight and you're ready with the amount of thrombolytic agent which needs to be given to the patient. So it's very, very important that how these medications for stroke are actually prepared, given, dosifying, and then monitored all along to ensure the better cares. Surgical care and safety in case, yes, in case it goes beyond that thrombolysis, you need to perform invasive procedures, thrombectomy or any surgical procedure for open up, then obviously you have to follow the standard protocol or any consent process for anesthesia, or if you have to transfuse the blood or blood component, then obviously those things will come up in those cares. Last but not the least is about infection control. Very important again, and particularly our COVID-19 is not just infection which you get itself, but it's also carrying along with here and there. So how the sanitization, how the cleanliness, how the disinfection protocols are put in place in the center are very, very important. How the hand hygiene is practiced, again, is going down to the basics of hand hygiene for infection prevention and control. It's very, very important. If there are invasive procedures being done, obviously those are very, very important to ensure that there is no transmission of any microbial flora to the patient. So the best infection prevention and control practices to be followed and taken care of the patient. So this is all about the standard framework, which I can in very short time can give to you all. But once you get a chance, you can get a copy from us. Many advanced centers have already undergone the process, starting from first Lalita Super Specialty Hospital, which become the first one, and then Max and Tilvanchil Baby Memorial Hospital has already undergone this process. Ramesh, Narayana Health, Apollo, 2 hospitals, Metra, couple of them already undergone Zydus and all those SIMS. So this demonstrates that there is a need, and hospitals recognizing that this can really help. Not only standardization, but providing the better clinical care to the stroke patient when they come to their hospital. So this is something which actually is very important, how we can really help our patient in improving. And just before I hang up is, many hospitals claim that I'm the best hospital to provide this care. So I challenge them, you can't be best with best outcomes. You can be best when you have the best patient with you. Okay, when patient is not arriving in your hospital in best condition, your outcome may not be the best, and if you so it's pre-hospital care is important. The patient arrive in the golden hour, that much community awareness you have created, and when patient arrive in an emergency, your team is ready and understand what type of protocol you have to activate. If you waste their time, then obviously you won't get the best outcome for the patient, and obviously then you can't claim your best outcome for a hospital. So I think in order to become best, you have to ensure your patient comes in the best condition, particularly in such diseases like cardiac arrest and neurology and stroke, where time matters, and which each loss of second, I'm told the millions of neurons damaged. So you save millions of neurons every second, is you can understand the time importance of time. So thank you very much for giving me this opportunity, and I hope you take any questions